Hi there, my name is Gerard Green. I'm one of the clinicians at the physio clinic in Barefoot in Harborne, and it gives me great pleasure to introduce you to Fiona Miles, who is our really specialised paediatric neurodevelopment physio. So Fiona, good to see you again.
Hi Gerard, good to see you too.
And it was nice to see you in clinic just a couple of days ago on Friday, because we're now just kind of the third week in September. So when I've seen you in clinic, I've seen, people bringing in kind of 12, 18-month-old babies to see you. I've seen people bringing toddlers to see you. I've seen people bringing, kids who are 8, 9, 10. I've seen teenagers come see you. So it's really, I'm always really fascinated in the kind of range of babies, toddlers, children you see. And just tell us what you do.
Well, I think that's sort of what drove me to be a paediatric physio, is that it's such a diverse range of children that you see, like you say, from a 12-month-old to a 12-year-old, ranging from things that are parental concerns about gross motor development or difficulties with skills as they become into the school age round, where they are struggling with walking, or they just appear to be not doing things that their peers are doing. That's quite a lot of what the sort of things that I get. And then obviously my other sort of, the other side of things generally tends to be the kids that do have a known medical condition, and whether that be congenital, whether that's acquired, some of the things that can happen during normal development in children that gives them pain, particularly sort of in the teenage years, and that's why I get a lot of teenagers as well. So what's quite nice is that I can work with the child and parent, but also linking with their NHS physios as well as, not as an instead of. So it's great that they're getting the extra bit of an expertise from myself and the support from the NHS services, as well as their parents, carers, whoever is with them.
And what's the most kind of, what are some of the common conditions that you'll see toddlers or children for?
So toddlers tend to be concerned around whether they're walking with their feet turning inwards or their feet turning outwards. They're not able to start to balance on one leg or jump, or they've got, a lot of parents are concerned about whether they've got flat feet, or maybe they were born with a slight deformity of their feet or hips, that they're then concerned that when they get walking, something just doesn't look right, and they're wanting that expertise just to reassure or guide them into how we can improve things for the future. Then it's the other children that are your cerebral palsy children or your Down syndrome, who are helping to do normal development, promote those normal learning movement patterns as they go through those preschool years.
And although I work kind of next door to you, I always wonder what magic goes on in there. So do you want to just maybe tell us what you do with some of those kids?
So generally, most people, whenever I'm a student, they say, it looks like you're just playing and having fun. And that pretty much is how I want it to be, because you want that child to feel like you're just getting them to play a game. So a lot of it, as you can see, I spend a lot of my time on the floor, and we get down, we use different equipment, we use a gym ball, we'll use balls, we'll have stacking cups if they're sort of like a preschool age. And a lot of it is going right back to basics about play on the floor. Lots of prone work, so that's lying on your tummy to develop those skills and stability around the shoulders and hips. And then empowering the parents and advising the parents on what they can do at home, thinking about how they could use their furniture at home to be able to assist in them carrying out the sorts of things. Because I can't be with that child 24 hours a day, but their parents are. So I've got to make sure that parents got a good idea of what activities and games can we play that are going to promote the things that we're concerned about and get them on the right track to getting that normal development going. So you'll probably hear tears from some of them, because obviously some of it's hard, it is difficult, and human nature is we don't particularly like hard work, particularly as a kid. If you can get away with it, we learn pretty quick. If we cry, most people generally stop And in general, you know, we'll work together to make sure that they can increase their tolerance of different positions. So we'll be working on our knees, we'll be working in this position as well, using lots of nursery rhymes, lots of games. You know, with the older children, I've got some throwing and catching stuff that we do. We get the bubbles out, even just putting on an iPhone with something for them to watch whilst I'm just demonstrating some stuff to the parents. That's very much how we work together with parents to make sure that their child is happy and they're happy with what we're doing.
And I think what I really like is that, like a bit like some of the patients I see, I spend a lot of time with them. You know, I spend either between 60 minutes and 2 hours with them. And I think what I like is that you spend with some of those more complex conditions, you see them for the first time for an hour and a half.
Yeah.
And I think that's quite nice because obviously it, as you said, it gives you time to assess that child,
yeah,
but also lots of time to explain that to either parent or carer or guardian,
yeah,
and also time for you to treat them, but also that really valuable time where you go through with the person who's there with them, what they can do, because as you say, you're not there with them all the time.
That's right, and that's the biggest thing I think is about the time together. Is it gives that child time to get accustomed to me, get used to the environment. You know, often it's the first time they may have been anywhere like that, and it's all a bit scary, particularly now when we're wearing masks, gloves, and apron. But it's given that time that I can make sure that the parents are going away feeling that they've understood what's happening and what the plan is, and that they've got something to go away with to do as well. And then, you know, with the older child, that they've understood what we're doing and making sure they feel a part of what's happening, and it's not just something we do to them, it's something we do with them.
And then you also see lots of kids with things like hypermobility, Ehlers-Danlos loss. So what do you do with those kind of very flexible, bendy kids?
So it's all about sort of ensuring that we gain some core stability and some core control, because obviously we're not going to change the fact that they're hypermobile, but what we've got to try and do is make sure that they build the strength in their muscles around their major joints so that they've got that stability and reduces their symptoms of pain, or maybe their prevalence of falling over, or, you know, improve their skills like their balance, because often their balance is really bad because they've just got instability at hips, knees, ankles. You know, it may even be that their handwriting is really poor, and a lot of that comes down to they've got really instability around the shoulder, around the elbow. So we'll be working on lots of weight bearing. It's really about building up that strength and empowering the parents to realise that this hypermobility is not something to stop them from doing. Actually, we need them to be doing and encourage them sort of sporting activities that they might want to take up, and trying to build in that exercise as part of their routine for the long-term future.
And then you also see lots of kids, you've talked a lot about kind of developmental delay and maybe people not, or children not hitting these developmental milestones. And then you also see lots of children with autism related. So tell us a bit about that, because I'm quite interested.
So generally, with the kids that are on the autistic spectrum, they've obviously got lots of sensory issues, which can give them problems with their walking patterns, can give them problems around their ability to sit and stand. Because they have got hypersensitivity. So we work at sort of desensitizing, but also work on whether they've developed some shortening in some of their muscle groups, or whether they've got some weakness because they've been sitting in poor postures, just because they can't cope with their environment they're in. But obviously that's a quite specialist area, because every child with autism isn't the same, as humans aren't the same, but we have to sort of understand what the way they may feel about sort of hands-on and tactile stimulation from me being the clinician working with them, and how sort of we've got to work with that. I know a lot of the time it's not understanding how they perceive the environment. So, you know, the bright lights, the noisy traffic and things like that will have a massive effect. So we'll talk about things like that to sort of dampen things down to be able to then do what we want to do. But it's taking it very slowly with those sorts of children. A lot of them are toe walkers, and a lot of them are toe walkers because of the hypersensitivity that they've got. So there are a lot of them, particularly, you know, a lot of people say at 2 and 3, oh, they're walking on the toes, it's fine. But it's as they get older, it doesn't get any better. And there are a lot of the reasons that they come to see me is because they're still walking on their toes, and this suddenly becomes a big issue when they can't stand properly to wait in a queue at a bus stop or in a shop, or just to stand and talk to mum without fidgeting all over the place. So we'll work a lot on that, bringing them back down to the basics of just being able to balance like this, for instance, because a lot of the time they can't, they're fidgeting all over the place. So that's a lot of what the work I do with the autistic children is around.
I think all of the kids quite like, and the parents quite like barefoot, because once you walk through those doors, it's quite a calm, chilled environment.
It is. It's real, and that's what, you know, a lot of the feedback that I've had from families that have come in is how it is calm, because there isn't a lot going on, you know. Very much a lot of other places you'll have lots of stimulation and lots of different things going on, which are very distracting for children and make it very difficult to concentrate during their time with me. But that is the nice thing that at Barefoot is that we do have a nice calming environment. I'm not rushed by the fact that there are 20 other people in a waiting room, so we've got that time to spend, and that's what I love about coming to work at Barefoot, is that we've got that time to spend and be with those children and their families, so that they can feel comfortable and confident that they know what they're going to be doing over the next couple of weeks before they see me again.
And I think also because we're quite a small but kind of specialized clinic, you know, there were only ever 2 of us in clinic together. Yeah. So so even particularly now during COVID, you know, you come in there and you kind of have that big area. You have that waiting room to yourself,
so I can make the most of the extra space outside the room when we need it. Yeah.
And then you also get loads of referrals from Mr. Bish, who's one of our brilliant local orthopedic specialists. So what kind of children is he sending you?
So he's sending children that are presenting to him as toe walkers for no reason. He'll send through things where things like the Osgood slatters, so painful knees, that's part of a growth related element for teenagers, and other conditions like that. We've had some children with clicky hips, not necessarily the preschool children, but teenagers, pubescent girls often get issues around their hips with pain and instability, and so he'll send those through, and we work quite closely together, both through Barefoot but also in other services as well. So I've known him a long time, so it's quite nice, we can go back and forward to each other where we need to.
Brilliant. So we love having you in the clinic, Fiona. We love
good. I love being there.
And also, you know, you do really remarkable work with lots of kids who've got, and I think that the work you do really helps those kids, but also helps kind of really bring a lot of calmness to a lot of families and households. Like,
yeah, I think that's a big part of the role of it as a paediatric physio, is that it is about having an impact on that family and not just the child, and realizing that you have a child in front of you, but it's the whole family around that child as well that are involved and invested in that child's future. So it's really, you know, I love working with families. That's what I love doing. It's not just one person. I've got a whole range of people. Siblings can often come as well, and we engage them in the activities, and you know, we don't exclude them. If we're playing a game together, the sibling can join in as well. I'm quite happy for that. I'm quite used to it from a big family, so I'm used to lots of kids. It's not a problem.
Likewise. So I've got 4 kids, but 3 of them are now in their early teens. So kind of maybe last thing. So what do you see? What are those kind of older kids who are 13, 14, 15? What are those coming in to see you with?
So commonly they're coming in with instability problems, that's due to their growth hormones that's going on. They're having massive growth spurts and they suddenly get really tight and they're getting lots of pain and discomfort. And some of them are coming through as well, unfortunately, with sort of chronic fatigue, post-viral issues as well. And with those, we're sort of needing to work on pacing and often returning back to education, so linking in with their school and making phone calls to them to look at how we can actually get them back into that sort of school environment. So, you know, that a lot of the teenagers are around that, or it may be that they've had surgery for a long-term condition that they've already got, and they're just wanting an extra boost on top of what they're doing at home, because it's really important that they want to get back and get rehabbed as quickly as possible. So sometimes we get those through as well.
Brilliant. And then maybe lastly, so you've obviously got a very busy life. You work, you know, as a paediatric specialist in the NHS. You work with us in Barefoot. You've got 2 children. So what do you do? What do you do kind of outside of work?
Oh, I took up running about 5 years ago, and I absolutely love doing that. I must say, sometimes I'm not as good at doing it as others, but I am generally quite an active person. I enjoy gardening, and just being outdoors is my thing. You know, I like to be active. I don't like to just be sitting still. My husband says I don't sit still. I generally sit down and then I'm up again and off somewhere else. You're
doing well. You're doing well at the moment.
I know, and I'm trying really hard not to be moving around, because I do generally move my arms and move around quite a lot. But yes, I like the outdoors. Over lockdown, I've built a pallet decking area in my garden and dug up flower beds and re-established things. And I've started upcycling second-hand furniture as well. I don't know where I'm fitting the time in, but
yes, I hate to say it, but you're going to make me and many other people feel very inadequate.
Sorry.
Right, Fiona, brilliant, brilliant, brilliant. I look forward to seeing you in clinic very, very soon. And Fiona is in clinic with us on a Friday. Yeah. She does a Friday from about 10 to 2 o'clock. And she's always really busy. And if anyone has any queries, they can obviously get in touch with us. We can tell you how. And Fiona, thank you very much. And
that's all right. Nice to speak to you.
Work you do also.
Okay, it's nice to see you. Take care.